She was Tun Sufyan's wife. And he said, "Is that your boss's wife?" And Tun Sufyan said, "Yes." The policeman thought he was talking to a driver, a Judge's driver. And he said, "The next time, don't do anything like this. I will let you off this time." The important thing about Tun Sufyan was he did not tell the policeman who he was. He did not take advantage of his position. And I think that was Tun Sufyan, a truly fine person. And I think it's very, very important. Some of you may become judges and magistrates later. Tun Sufyan always remembered this. The most important person in court was not the judge. It was the person who lost his case. That person must go away thinking that he or she had received a fair hearing. And that is something I would like you to think about. It is not enough knowing everything in the law books, not enough knowing everything in the medical books. Having just the technical knowledge is not good enough. I think it is important to be a fine person, and I would remember Tun Sufyan for that. Another person I would like to remember, to pay tribute to, is Dr. M.K. Rajkumar. He was formerly the president of the Malaysian Medical Association. He was active in the University Council in this university. He was a man with a big heart. He was a first-rate clinician. He was an active politician at one time. He was the first political prisoner in Malaysia whom Amnesty International adopted as a prison of conscience. He worked very hard in defense of the poor and the oppressed. And his contributions to our society should not be forgotten. And I would ask you to keep in mind his fine example. Now, about the doctor-patient relationship, it is a changing relationship, I must say, and sometimes I think it is changing for the worse. You see, at one time, there was so much of trust and confidence in doctors and lawyers. I'm sorry to say, things have changed for the worse. One particular development which I think has not helped doctors is the growing role of business interests in medicine. When commercial entities are active in the delivery of health care, patients tend to take a mercenary attitude. Frequently I hear this complaint from patients. We paid so much money and yet our father died. Typical thing like that. Now I must say, a lot of Professor Kulendran's remarks about the problems that doctors face are applicable to lawyers too. Lawyers who don't listen to their clients, who are not sympathetic to their clients, who don't explain things to their clients. Things can go wrong. And I think it's very important that doctors and lawyers should work together to attain a fair and just society. Lawyers are not just concerned about winning cases in court. They should be concerned with promoting a just society. Let me give another example from this university. There was an economics graduate who took a student loan. I'm sure some of you have taken student loans. Upon graduation, upon getting a job, you're supposed to repay the loan. This graduate did not repay the loan. Finally, when the university caught up with him, the claim was barred by limitation. That's an important point. This economics graduate, by that time he was a successful executive in a big company, saw a lawyer and told the lawyer, I have a defense. The claim is barred by limitation. You know what the lawyer said to him? And I commend that lawyer for it. He said, whether the claim is barred by limitation or not, you pay back the money. Do not let the law blind you to what is just. And I'm sorry to say that many a law graduate forgets that. There's more to life than just knowing what the law is. And I regret to say that I've come across lawyers who know all the law but know very little about what is fair and just. And I think that is very, very important. That sense of fair play is very, very important. I think the best lawyer is the lawyer who is a true sportsman. I say a true sportsman, not a good sportsman. A true sportsman will play fair. You have heard of Kim Clijsters, I'm sure, the tennis player. She was playing against Dina of China. All the TV cameras were on. The ball landed in Kim Clijsters' court and she could not take the ball. The ball was in. The umpire said out. She told the umpire the ball was in, that she was giving away the point. Now, of course, you may say, because all the cameras were there, she had no choice but to say that the ball was in. But look at this German goalkeeper, right, during the World Cup. The ball went in and he did not tell anybody about it. I asked an expert in the UK, by the way, a doctor who was an advisor to the Football Association. He said, well, you have to play to the whistle. So my thinking is, in such a situation, it was the duty of the German team, all of them, to try and get the ball back into their goal, score an own goal. Did they do that? No. But it is not just about getting results. I remember, a professor from the medical faculty in this university once complained to me about lawyers. He said, lawyers are only interested in a conclusion. They are not interested in justice. And I think that's a very, very telling point. And in regard to the doctor-patient relationship, therefore, I think it's not enough for lawyers just to say, well, the relationship between a doctor and a patient is a contractual relationship. You can start talking about the law of contract, offer, acceptance, etc. Oh, there's a duty of care in the law of tort, etc. The Supreme Court of Canada in one case said that the doctor-patient relationship is one of trust and confidence, that the doctor has a fiduciary duty to the patient. So when a patient asks for information, the patient has a right to the information. So the Supreme Court of Canada decided in a case that a patient had a right in law of access to the medical records. Now, my experience in Malaysia is that many, a doctor or hospital, on the advice of lawyers, will say, don't disclose medical records. That leads to a lot of problems between doctors and hospitals on the one side and patients on the other. Now, I'll be the first to say that sometimes when things go wrong in a hospital accident, the lawyer makes it worse. Because the lawyer may advise, don't disclose, don't apologize. I have seen it. But let me give two examples where an apology worked. Same doctor who made two mistakes, one after the other. In the first case, an English lady, the doctor was English by the way, practicing in Malaysia, an English lady went to see him after she had suffered a fall. The ankle was quite painful. He ordered an X-ray film to be taken. Now he did not have the facility in his clinic, so the patient went out to an X-ray center. The film was taken. He told the patient, I will let you know the findings on the X-ray film later. Due to an administrative and clerical error, the results were not disclosed to the doctor. The clinic nurse maybe should have taken the film, but the doctor said, here's the report, here's the film. The report showed that there was a fracture. So the patient was not told there is a fracture. She went to England a short while later. The pain continued. She saw another doctor there who ordered X-ray films, and that doctor told her, you have a fracture. Now, clearly, the fracture had arisen from a fall in Malaysia. She did not suffer a second fall in England. She did not go to some Tukang Urut, who massaged the ankle and made it worse. So, the source of the problem was in Malaysia. She wrote a letter of complaint to the doctor. The doctor came to see me, and he told me frankly that he had made a mistake. That he should have reported to the patient that she had a fracture. So we prepared